Well, an early good afternoon to all of you who are on the line. Welcome to our last COVID Learning Exchange for this year. It's come up really quickly, and we're honoured today to be joined by two very well-versed people around the COVID vaccination rollout for Queensland, and they are Scott Brown, who is the Assistant State Director for the COVID Vaccination Task Force. Welcome. And Dr. Lynne McKinlay, who is the Deputy Chief Health Officer. So thank you to both of you for generously sharing your time with us this afternoon, where we're going to be talking a little bit more about the vaccination rollout, which we began. Our first COVID Learning Exchange this year began with the discussing the rollout and how that would look. And we're rounding off the end of the year with a discussion about how we get a little bit more momentum and we push that in the coming months. And answering some of the fantastic questions that have been submitted during the registration process. So thank you to all who have submitted a question when you registered. My name is Stacey DeCalma. I work here in the sector capacity team at QCOSS. And it's my pleasure to host this COVID Learning Exchange today. I would like to acknowledge the Yagara and Turrbal people on whose land I'm sitting here today at QCOSS. We're in lovely West End, and I'd like to pay my respects to their elders, past and present, and of course acknowledge the traditional custodians of the lands where all of you are coming from today, and acknowledge their ancestors and their continuing connection to the land and the sky and the sea. All right, without any further ado from me, I'm going to hand over to Scott and Lynne. You can probably say a little bit more about yourselves, and once you'd like me to get the presentation up, just let me know and I'll do that.
Thanks, Stacey. As Stacey said, my name's Scott Brown and I'm the Assistant State Director for the COVID-19 vaccination program. Ms. Bronwyn Nardi was meant to do this presentation today, but Bron had to duck off to another commitment. So she does send her apologies, and I hope it's okay for me to present on Bron's behalf to you this afternoon. I'd also like to introduce one of the three Deputy Chief Health Officers. It's really a real privilege and an honour to have Dr. Lynne McKinlay with us and join us today. So,
hi everyone, thank you for allowing me to join. I've been doing this for a couple of months now. I've done my background and yeah, it's great to be part of this team, and it's wonderful that you've all been able to join us and hopefully ask your questions, and we're going to do our best to answer them.
Yes, we will. Now, this afternoon, Stacey, I thought what we might do is set the sort of the global context, talk about what's happening globally, then sort of bring it back to where we are here in Australia, a little bit tighter into Queensland, and then we might sort of dive a little bit deeper in terms of what we've been doing, particular work we've been doing across communities across Queensland. So I'm wondering whether you could share the presentation for us whenever you're ready.
Yes, absolutely. And just a quick note, if you didn't share a question during the registration process, but you do have a question or something is mentioned and you want to know a little bit more, please feel free to submit a question via the Q&A function, which you will see down the bottom of your screen. And we will do our best to get to as much as we can.
And while Stacey's bringing up the presentation, Lynne and I would also like to acknowledge the traditional owners or the custodians of the land in which we're meeting today, and pay our respects to Aboriginal and Torres Strait Islander people as well. And I also extend this respect to all Aboriginal and Torres Strait Islander people on this afternoon's call or meeting. So if we go to slide 3, Stacey. There we go. So I think it's reasonable to say that COVID-19 has had a fairly significant impact on global health. So globally, we know that there's been more than 219 million cases of COVID-19 and sadly, more than 4.5 million deaths. And it's impacted both first world countries and developing world countries. And just to give you an example, some of the worst hit countries, we know in the US, There's been about 46 million reported cases of COVID-19 and 750,000 deaths. In India, there's been 34 million cases reported and 450,000 deaths. And in Brazil, there's been about 22 million cases and 600,000 deaths. So a really significant disease event for the globe. Here in Australia, we've been very, very fortunate. We've had about 145,000 cases and sadly 2,000 deaths. And here in Queensland, we've been even more fortunate. We've just seen around 2,000 cases, but sadly 7 people have died from COVID-19. Our response has been broadly based on border restrictions, limits on movements and gatherings, physical distancing, mask wearing, hand and respiratory hygiene practices have really been the measures that we put in place to manage this response to date. And these measures have been relatively effective, primarily thanks to Queenslanders who have heeded the public health advice right throughout this pandemic response. And these measures have adjusted over time to reflect the public health situation. And many of these will continue to be quite important, but the rollout of the vaccine this year has been the main focus. And we know this because the vaccines are the most effective tool that we have to prevent serious and severe illness, hospitalisation and death. So we'll just move to the next slide, Stacey. Is audio okay? Stacey, can you hear me?
Sorry, my mute button just disappeared on me. Yes, I can hear you fine. When Bronwyn speaks, you might need to come a little bit forward, Bronwyn, because when you were speaking earlier, it was cutting in and out a little bit. So just a little tip for when you are speaking. But we can hear you fine, Scott. Thank you.
Yeah, thanks. Lynne will come up when she wants to speak. Thanks. Okay, so the vaccination program here in Australia is sort of wrapped and has a formal governance framework around it. So this framework is outlined in the COVID-19 vaccination policy, which was endorsed by National Cabinet on the 13th of November 2020. And that policy clearly outlines the roles and responsibility of the Australian government and the state and territory governments. The Commonwealth is responsible for selecting, curing, and all of the regulatory approvals that are related to COVID-19 vaccines. They're also, interestingly, responsible for transporting the vaccines to the point of vaccination. So they're responsible for getting the vaccines to our state-run clinics and to our GPs and our community pharmacies. That's an incredible, large logistical exercise that the Commonwealth is currently undertaking. In terms of state and territory governments, well, we're responsible for administering the COVID-19 vaccines, and we primarily do that through our state-run clinics. Back in, I think it was February, the Australian Technical Advisory Group on Immunisation, that's the body of the leading committee of immunisation experts in Australia, essentially determined who the priority groups for the vaccine would be. And they based that determination on those groups that had the highest risk of exposure to COVID-19 and those who are at highest risk of serious disease from COVID-19. And so the rollout was based on 5 phases. You remember right back in the beginning, phase 1A included healthcare workers, and they were really healthcare workers who had potential contact with COVID-19, our quarantine and border workers, and our residential aged care and disability care residents and staff, all made up phase 1A. Then phase 1B came into play, with the program being broadened to people who are elderly and our First Nations people as well. And then the phasing was adjusted as the program sort of rolled out through this year. In terms of our program here in Queensland, next slide, Stacey. Sorry, I've got to get into the habit of saying next slide. Our program started or commenced on, Monday, the 22nd of February at the Gold Coast University Hospital. It was a really exciting day and a real turning point in our COVID-19 response. So we essentially set up right at the beginning 6 hospitals to commence the vaccination program. And those hospitals were selected based on their proximity to the international border, but also the role that they played primarily supporting hotel quarantine programs. And so those hospitals were obviously the Gold Coast University Hospital, the PA Hospital came online, Royal Brisbane, the Sunshine Coast University Hospital, Townsville and Cairns were all established within a couple of weeks of each other to start rolling out the program. But now we're really proud to report that I think we've got nearly 63 acute hospital settings right across Queensland are now set up to have the capability of administering Pfizer to their populations, including Thursday Island Hospital. So right at the beginning, if someone told me we would be able to administer ultra low -70 degree or even get ultra low temperature vaccines onto Thursday Island, onto very, very remote tropical islands, I would have said you're crazy, but we've done it and we're doing it, and we're doing it almost every day of the week, which is fantastic. We've also set up 28 community vaccination locations. So these are these big mass vaccination sites that we have here in Southeast Queensland, but they're also inclusive of those smaller community venues that we have peppered right throughout the state. We have delivered almost 300 outreach services to our remote towns and our remote communities. And a lot of these outreach services are now on sort of the built-in regular BAU, business as usual sort of practices for our hospital health services. And now that the program, we call it a pivot, the program is pivoting to pop up and offer pop-up vaccination clinics to where people live, work and play. And on the weekend, we popped up at 116 secondary high schools halls across Queensland, and we administered, I think, nearly over 14,000 doses. So just a tremendous effort. All of our clinics, absolutely every one of them are walk-in clinics. There is no need to book. Having said that, though, people can go online and still book in. If people prefer to book in for an appointment, they can absolutely do that. But our clinics will accept walk-ins. I just wanted to mention that our primary healthcare play an incredibly important role in vaccination. We know that here in Queensland, our GPs administer almost 85% of childhood immunisation services. So they play an incredible role, they're a critical role in delivering vaccination. And so we've been working in partnership and tandem with our GPs. Our community pharmacists have ordinarily a really important role in rolling out flu vaccination programs across the state. And now they have playing an incredible role rolling out AstraZeneca and Moderna to the eligible population. And when you look at that 16 plus eligible population, we're talking about 4.1 million Queenslanders. Next slide, Stacey. I thought we'd throw in a photo of our fabulous Cairns team. Cairns was the first HHS to bring online their COVAX van. So they are able to go out to sort of remote and hard to reach communities across the Cairns and hinterland region and offer the vaccine. Basically, Cairns led the way. Other HHSs cottoned onto the idea and loved the idea. And most HHSs now have that sort of mobile capability so that can dispatch teams out across to their communities and vaccinate. Next slide, thanks, Stacey. Just like to share a couple of key statistics for you for Queensland. So this data is up to including Tuesday, the 19th of October. You can see there that we've administered more than 5.6 million doses in Queensland. That's across our clinics and also through primary care clinics. 2.8 million of these have been actually administered through our state-run clinics. And then more than 3 million have been first doses and almost 2.4 million have been second doses. I think my maths is a little bit off there. I think that should be 2.6, but roughly about 5.6 million doses have been administered to Queenslanders aged 16 plus. The graphs down there on the bottom should show the uptake or coverage rates by sort of key age cohorts. So you can see the green shows the proportion of people who have been had 2 doses. The blue show the proportion of people who've had at least 1 dose, and the greys are the proportion of people who have not been vaccinated. So the good news story out of this program to date is that 81 or nearly 82% of our 70 plus cohorts people have had 2 doses. And this is incredibly important because we know that old or elderly people are particularly vulnerable to COVID-19. And at least 94% of our elderly have had 1 dose. In terms of our 50 plus age group, we have about 73% have had 2 doses and 87% have had at least 1 dose. In terms of the overall eligible population of 16 plus, we know that 58% have had 2 doses. In fact, this data's out of date because I looked at the data this morning. 60% of our population age 16 plus have had 2 doses, and 75%, nearly 75% have had at least 1 dose. Next slide, thanks. So this is just showing coverage a little bit differently. This map of Queensland shows 12 plus coverage by LGA, by local council area, showing at least 1 dose. The picture essentially shows the greener the areas, the better, the more higher sort of uptake and coverage rates. So you can see through the coastal region, most of the coastal regions down through southeast Queensland, out through the Darling Downs, through southwest, up through central west regions, we've got really good coverage, first dose coverage. The amber orange areas indicate where coverage is not as good, and there's particular low or coverage I think it needs to improve in areas northwest of the state and right on the Cape. There's been some fantastic Cape outreach programs being running now in the last sort of at least 4, 6, 8 weeks. And I'm very confident that we'll be able to offer those communities and continue to offer those communities vaccination and get those rates right up. The graph there on the right-hand side is actually a really interesting graph. It shows coverage by really specific or tight age cohorts. And I want to just draw your attention to the grey bars. The grey bars show the number of unvaccinated people in each of those age cohorts. And if you add all those grey bars up, we've got about 1.2 million people aged 12 plus have not yet received a dose of COVID-19 vaccine. And about half, almost 600,000, are in that 20 to 49-year-old age cohort. So we really want to see our young Queenslanders come forward and get vaccinated. We absolutely need to improve our uptake in our younger age cohorts. Okay, so that's the key stats. So just wanted to talk really briefly about some of the work we've been doing with our communities. As I said earlier, our aged care and our disability care workers and people with a disability, they're absolutely our highest priority. They are being identified in phase 1A for vaccination. And when I look at the rates across, I call it the disability sector, so people with a disability, their carers and their workers, I'm seeing that we've got about at least 70% of that sector has had at least 1 dose of vaccine, which is really good news. We're seeing higher uptake in our aged care sector. Our residential aged care facility residents have a coverage rate of at least 81%, 2 doses, higher for at least 1 dose, and our workers, our residential aged care workers, have 87% 2 doses coverage rate, which is fantastic. And our elderly, as I said, just generally more broadly, have at least 80% have had 2 doses. With our culturally and linguistically diverse communities, we recognise that not one size fits all, and we've been working really hard with our Cole community lots of face-to-face meetings, lots of opportunities to meet with our multicultural and COLD community leaders. I think to date we've done nearly 40 face-to-face meetings and have met with nearly 750 community multicultural community leaders and key people in our COLD community. We've also been taking the program to community clinics. There's a particular hub down at Logan in the Gould Adams Hall where we've now rolling vaccination or vaccines out from, which is going incredibly well. We've been popping up in places of worship, in multicultural festivals. We've been in high schools. I was at Mansfield High on the weekend and saw fantastic turnout of large multicultural families coming out to be vaccinated. It was such a great thing to see. And we're also been working with the TAFEs and the multicultural programs being offered through TAFEs as well to offer vaccine to our multicultural Queenslanders, our COLD Queenslanders. We've also got a really firm partnership and strong partnership with our Mata Refugee Help Network, and we partner very closely with them to offer the program through that network. We've done some really interesting work with people who are experiencing or at risk of homelessness. We've had opportunities, particularly when we've been in lockdown, been able to offer vaccines to people in places where they're being accommodated. I know Metro North is also working really closely with organisations, really credible and trusted organisations like Orange Sky to offer vaccines through that pathway as well. We've got a very comprehensive First Nations strategy, and it is really sad to say that there's a real key statistic that keeps me up at night, that nearly just over half of our First Nations people have yet to be vaccinated. So we've got a really strong strategy in place to try and improve the uptake amongst our First Nations people here in Queensland. Our correctional facilities and our youth detention centres, we've rolled the program out to all of those facilities. In fact, we've got those programs and those facilities now embedded into scheduled services, so almost like business as usual now, that they're on a routine sort of roster of visits, so we can offer vaccine to staff as well as inmates as well. Our boarding schools, before the September school holidays, we reached out to all our boarding schools across Queensland and offered vaccination with the parental consent for all boarding school students. And we've also, very, very early on in the piece, vaccinated our critical and high-risk workers, our police and our emergency service workers, as well as our healthcare workers. So they were vaccinated very early. Next slide, Stacey. But we do recognise that there are other hard to reach cohorts, and it is a constant challenge for us to be able to offer vaccine to these cohorts, and we would seriously welcome your feedback on how we might be able to reach out and access and offer vaccine to every Queenslander, but particularly these sort of harder to reach community members. I just wanted to call out the last bullet point there. There's sometimes a bit of confusion around this. Anybody can walk into our vaccination clinics and get vaccinated. You do not need to have a Medicare card. We will vaccinate you. So I just wanted to call that out for everybody here online. Next slide, thanks. So last Monday, I think it was, Lynne, last Monday, our Premier announced our plan for opening the borders, and this is this document here on the slide outlines the vaccine plan to, as I say, to unite families. There's travel restrictions will ease. Restrictions will start to ease as we see coverage rates hit these milestones. I personally can't wait till we hit the 90% milestone. I absolutely expect us to hit it. There's no reason why we can't. We know here in Queensland that 95% of our children are vaccinated. The vast majority of Queenslanders support vaccination. So I'm absolutely determined to get to 90%, and I think we will get to 90%. Lynne, did you want to say anything on the vaccine plan per se?
No, I don't think so. I think it's made it a bit easier for people to see what, where we're going, and certainly I've noticed for some, I think for some of the younger people, that hard to reach group, it will be that that travel, that opportunity to move around, that will probably be a bit of a personal incentive for some of those people.
Yeah, yeah.
So I think it's been a bit of clarity for people. I think it's been good.
Very clear. Yeah. Thanks, Lynne. Stacey, next slide. So, where to from here? So we obviously need to continue to partner with our primary health networks and our community services. It is absolutely critical that we partner with agencies and organisations that have trusted relationships with community and community members. And so that's what we're really focused on, to make sure that we're linked in into these sort of community networks that are really solid and robust. We do need to do a little bit a better job, I think, in terms of avoiding duplication. There's lots of well-meaning and well-intentioned sort of programs being rolled out across the state by Commonwealth and Queensland, and so we just need a little bit of collaboration, and we're doing that with the Commonwealth, and we're improving that all the time to avoid duplication. Clearly, we need to continue to identify gaps and facilitate those partnerships as I just mentioned. And look, if necessary, we will go door to door in our discrete First Nations communities. We've done that in the Yarrabah community. We've done that in Cherbourg community. It is very effective, and we will roll it out, and we will go door to door in our remote discrete First Nations communities if need be. We continually need to come up with bespoke solutions to address some gaps and embrace opportunities. And one such bespoke solution that we're just currently rolling out is, it's almost like a vaccination service case management service being offered through 134 COVID. So if people are homebound or are unable to easily access or conveniently access vaccine, they can call 134 COVID, and 134 COVID have a team, an engagement team in place to basically work with the local primary health network and to link that person with the vaccination. So I'm actually really personally excited about this development, and I think it's exactly what we need going forward. We will expand, as I mentioned, the Coal Community Engagement Project, and this is being led by the Marta Refugee Health Network. We've got vaccination plans and translated materials, and we've done a lot of information sessions for our coal community. Now we're really at the pointy end. We want to engage to vaccinate, and so we'll be working really closely with the Marta and through that project to make that possible. We expect a booster shot announcement sometime this week. A couple of weeks ago, ATAGI recommended that people with underlying medical conditions should have a 3-dose course of a Pfizer vaccine. So that is currently underway, but I suspect that there'll be announcements around sort of a broader booster dose program being announced shortly. And being able to prove that you're vaccinated will become increasingly important as we go forward. So we'll continually advocate to the Commonwealth about ways that people can easily access their vaccination records through MyGov or through the air or through their local GP. Next slide, thanks, Stacey. I just wanted to plug some really fabulous resources on the Australian government website that provides lots of information about the program and about the vaccine. There are particularly those tiles down at the bottom, there's information about how you go about getting your vaccine, what you need to do in preparation for your vaccine. There's fantastic information about how Australia approves vaccine. There is an incredibly rigorous process in place to approve vaccines here in Australia. There's a really good get the facts documentation and information on the website, and there's some great information about the aged care rollout for the program as well. And then just a plug, the next slide, thanks Stacey, that to book an appointment, you can go online. If you don't wish to book an appointment, you can just walk in, as I've mentioned, or you can call 134 COVID for any inquiry you have about the vaccine or about the vaccination program as well. And I think that brings me to the end of the presentation.
Excellent. Thank you very much. Lots of, it's great to see the context, I guess, and the work that has already been done.
Thanks.
Because that informs the work that's ahead. So thank you very much for that. We do have some questions. I'm going to go back to one of the things you only just mentioned a couple of slides ago, actually, and that's around the vaccine passport, or our documentation or proof of vaccination, because at the moment people can access that via MyGov. And one of the questions that was submitted during the registration process was how should this sector be assisting residents or the people that they're working with who don't use a smartphone or computers, and digital accessibility is something we talk about quite a bit here at QCOSS. So how do we assist those who aren't using technology to have proof of vaccination?
Yeah, so it's a really good question. The Australian government has made it reasonably easy to access your vaccination record if you don't have access to a smartphone. And I say this because I'm talking about my mum. My mum doesn't have access to a smartphone, and so she just called the Australian Immunisation Register, and she spoke to her GP firstly about getting access to her Australian record. The GP put her in contact, so there's a phone number that you can call, and the Australian Immunisation Register will post out your vaccination record if need be. So it's a really easy way, and my mum's done that, and she's got it, and she showed me, and she carries it everywhere she goes. So that's a really good example, I think, about how how you can access it.
And a question to follow on that is one that someone submitted in the Q&A box just now, and that's around the boosters. Will they just be added to the vaccination certificate or on their MyGov account when they happen?
Yes, they will. So the Australian Immunisation Register is set up as a whole of life vaccination register. It's we're one of the only countries in the world that has this register. We are incredibly lucky, and so every dose, or it doesn't even need to be COVID-19, any vaccine that you've had throughout your life gets recorded against the Australian Immunisation Register. If you've had vaccines administered overseas, you can make an appointment with your GP, just let the GP know what you're trying to achieve, what you'd like to do, and the GP can upload those vaccination records to the Australian Immunisation Register. I always have to plug 134 COVID. 134 COVID are an amazing service. If you're struggling with trying to get access to a record, or you're not quite sure how to get access to your record, please call 134 COVID. They're incredibly helpful.
Excellent, thank you. Tom has asked, what work is being done to support the uptake of vaccinations by people working in the child and family sector? For example, people providing residential care services for at-risk young people, foster carers, that cohort.
So we're reaching out. We work with the Department of Communities, and we have essentially, Stacey, a community engagement plan that constantly works across agencies to offer the vaccine. So I say to Tom, there are plenty of places that people can get vaccinated. You can walk into, I think it's nearly 700 or 800 community pharmacies that have Moderna, into any one of our clinics to get vaccinated.
I'd like to comment on the issue of children, because I did mention I'm a pediatrician. One of the things that we've seen in New South Wales, and certainly it's been seen globally as well, is that some of what happens for children is if people who care for them get sick, they cannot provide care for them. And so I think globally, something like 1 in 1,000 children have lost a parent. A parent has died or caregiver has died. And it's even higher in a recent study in the US in children of colour, where something like 1 in 300 of those had lost a parent or carer through death from COVID. It's just horrific. So one of the issues that I like to sort of talk about a little bit is that the adults in those children's lives getting vaccinated, whether you're a carer, a parent, an auntie, a football coach, a ballet teacher, whatever you are, the children kind of need you in their lives. And it's not just about preventing the children from infection. It's really just about continuing to provide that constant, consistent adult presence. In New South Wales, a lot of adults got admitted to hospital who were very, very sick. And the children actually weren't very sick, because we know that COVID doesn't cause the same severity of illness in those younger children, and yet those children were impacted negatively because those adults disappeared from their lives. It's really pretty worrying.
That's really
rarely disappeared from their lives in that situation.
Yeah, that's a really good point. It's these other implications, not just the health implications of COVID-19. This is a question, a technical question about the Medicare card and passports. If your Medicare card is in a different name to your passport, for example, your Medicare name is your maiden name, but your passport is your married name, will it still link? What name will your vaccination be under?
So the Australian Immunisation Register have essentially a team. So if for some reason the record doesn't automatically show, there is a team working with Australia. It's a huge team that work through and try and data validate and match the record as quickly as possible. And once they get a match, they upload that record. So they put in essentially significant resources and structure to make sure that is covered.
Excellent, thank you. I'm sure that team's getting very good at answering all of these kinds of tricky questions. Now we have a couple of questions in the realm around mandation, like mandating the vaccination. And then we also have a question that's been submitted around some of the future strategies to address the lower vaccination rates in the remote or Indigenous communities. So they're really both important to address, and I want to get to both of them. So how about we turn to mandating the vaccine? What can you say about the Queensland government's thoughts on mandating the vaccine for non-government organisation workers or any other groups?
Look, I can probably say what our approach has been to date. Of course, as with all things in the pandemic, just because we've done something in a certain way to date doesn't mean it may not change in the future. We know that we've all had to be pretty agile. But to date, really, our focus for mandatory vaccination has been on protecting vulnerable people. So that's why, and also the people, I guess, on the front line of the pandemic. So we started, as you probably remember, with mandatory vaccination for people who are working in the quarantine system, because they're obviously at most risk. And but the health workers, the police, and the hotel staff, for example, in the hotel quarantine system. And then moving towards health workers, aged care workers, police, and other people working in those sort of settings where there are vulnerable individuals, and we're still having that conversation now. So that has been our approach to date. As I said, it may change because we know that it has changed in other places in Australia, but at this stage, that's our approach. It's really about protecting, and if you like, I've heard this, I kind of like this phrase, this idea of cocooning, where you have got vulnerable people that we need to wrap the most protection around them that we can.
So we oh, sorry.
I just wanted to point out that the requirement to be vaccinated is not mandatory for most people, and so as we said,
sorry, your audio. Sorry to interrupt.
My mask. The requirement to be vaccinated is not mandatory for most people, and so it's for really good reasons we brought in the requirement, as Lynne said. I think it's just, and a thing that really sticks in my mind is, particularly now that Delta is the dominant strain, it's as contagious as chickenpox. And I think right from the get-go, I think Queensland's really taken it seriously, and I think that's what we've done. We're taking it seriously. Sorry.
Yeah. I think one person can infect 6, and those 6 can infect another 6 in a very short period of time.
Yeah.
You've got hundreds of thousands of people can be infected if you haven't got high vaccination rates.
Yeah. Get out of hand very quickly. So some of the other questions that I have here relate to how you recommend organisations respond to staff or volunteers who are worried about getting the vaccination. We have seen a bit of a divide amongst people who have some fear, and what we know about responding to fears is that if people don't feel heard and those fears aren't acknowledged, that they do tend to retreat or push away further rather than seeking clarifying information. So how should organisations or employers respond to those who are working with vulnerable cohorts? How should we address those fears?
I think it does come back to knowledge and information, and also I think to a sense of a little bit a sense of all being in this together, because we know that some people need their questions answered, and for most people that's enough, and it's about then who can answer that question. I think there is some very good reliable information on the website, on our website, and various others like Atagi's got some great information, and then of course your general practitioner, your trusted health professional. I was just recently out in Moranbah, which is got really very low, much lower vaccination rates than we would like. But out there, many of the health professionals, I guess, are known and trusted by their community. So I think going to the people that you trust and getting that information from the trusted source is probably the thing that is going to. And then I think the other thing is that when people kind of see that they are all in this together, and we go as a community to do it for our benefit, but for the benefit of protecting others in our community, that's also been a very helpful way, because I think often people will sort of see themselves as being part of that. And I think that's where the school vaccination program has been really helpful, because it's part of us all as a community to do this for ourselves, but also for each other. Do you want to add to that?
Yeah, at the end of the day, I completely agree. I'm just sort of having a look through my notes and said, people really should talk to their doctor. There are some really credible sources of information, and make sure you're reading credible source, peer review literature, credible sources, and just essentially vaccination is the best chance we've got to fight this pandemic. And there's real life studies coming out of Northern Hemisphere showing how very, very effective these vaccines are at protecting and carrying sick from them.
One of the things on that vein is that there'll be more local data coming. Obviously, in Australia, we've had, fortunately, fewer cases. However, even in Australia, what we've seen is that if people, I think there was a recent study, and I don't know if it's been published yet, in out of the 47,000 people in ACT and New South Wales who had developed COVID in that younger age group, 16 to 65, if you like. And I think of the people who died, there was only, I'll just get you the figure, it was 1%, I think. Only 1% have been fully vaccinated of all the people who died. And people who ended up in hospital, only 4% of them or something like that were fully vaccinated. So, there's a very compelling data coming through. And I guess the other thing just on that issue about protection from the vaccine, certainly it protects me if I get in contact with the virus because it's so infectious, but also it protects the health system. And you've heard people talk about this, but some of the data now is suggesting that in countries that have had a lot of COVID, the amount of deaths in those countries is much, much higher than we can just explain with COVID. Because when the health system becomes so impacted, people are also dying more from breast cancer or prostate cancer or heart attacks or strokes, because the health system, you know, can't cope with the other things that might kill you as well. And so that's, you know, that literature is emerging, and there was a very good article published in The Economist recently if people are interested looking outside of health literature on that.
I'm not sure if you got to finish your question, or if that affected you on your end.
I don't know whether anyone else heard it, but
hopefully everyone's still there and you did hear that. What I did just see a comment as you were speaking around the Far North Queensland area and the hospital, and you were saying, just as we all froze, around the health system. Thanks, Matt. That you know, one of the other reasons we're hoping to increase our vaccination rate is to ensure we don't overburden our health system. And there is a comment there around Far North Queensland, and that the hospitals up there, and making sure that we don't overburden that health system. So how about we do address the question around how we increase rates in some of our discrete communities and some of our vulnerable cohorts that haven't had the same uptake. We would love to hear for all of you on the line your thoughts about what could...
I was going to say, can we turn that question back to you? Because any ideas you've got, we're up for them.
Yeah, absolutely. So I know that MIPA Projects has received some funding to have a mobile vaccination bus, I believe it is. So that's one thing that's obviously has been funded and given legs. So we do have that. I'm just checking the Q&A at the moment. For those who have some thoughts about this, please put them into the chat. Would love to hear about it.
I was just going to make a comment while we're waiting, if I may, Stacey. When I mentioned I was up in Moranbah the other week, and last week, it seems like ages ago, but it was only last week. And the rates there are, as I mentioned, much lower than we'd really like to see. But one of the issues in some of those smaller country towns and those regional areas is they cannot.
Stacey, you just dropped out then. Can you hear us again?
Yes, I can hear you again. I'm really sorry, everyone. I'm not sure what's going on here. But we do have some comments coming in the chat. Thanks, Matt, for kicking that off. An important role for our industry to play is to help those who are hesitant to make an informed decision. So really seeing our sector workforce as that, I guess, conduit of information to get the right information out to people so they can make an informed decision. Because as I was mentioning before we came online, we here at QCOSS, we're often having discussions about human rights and ensuring that people do understand their rights and having really robust decision-making frameworks. So I guess what Matt is saying here is that we're assisting people to make those decisions with correct information.
Yes, that's excellent.
Okay, there's a few more comments here about Far North Queensland, which is great because I think that's a really important discussion to be having. So we've got here, are you able to share some further information about the future strategy to address the lower vaccination rates in remote or Indigenous communities? And I think that's what you're asking for some of our intel on today. We're about to send Brisbane-based auditors into very remote communities in Far North Queensland next month to meet our HSQF requirements. For anyone who's not familiar with the acronym, the Human Services Quality Framework, are we putting those communities at risk if we're sending auditors into remote communities? Great question.
Vaccinated? That's the first question, isn't it?
Yeah. So are they vaccinated?
I guess if an organisation is doing that, I guess it comes back to that issue, doesn't it, as to, everything ought not be about government mandating something, but an organisation taking a risk-based approach to look at what is our responsibility if we're sending people into a vulnerable community to choose to send people that are vaccinated. I don't know if you want to add to that, but I do think it's a little bit about individual organisations taking responsibility.
Yeah, I agree and completely with that. But also just in terms of uptake, we are working really, really closely with community leaders. We're working with services that have on-the-ground services that are trusted in those communities. And we're just trying to break down the misinformation and the myths and just be available to answer questions, I think is really, really important. And as Lynne says, if people have sort of a tip or an idea that, have you tried this pathway? Have you tried this conduit? We'd be really open to that, because at the end of the day, I want every Queenslander who's eligible to be vaccinated.
Yeah.
I think Tom's comment there about a place-based community-led approach is a really important one. Is who are the best people to partner with? I mean, obviously Queensland Health or the pharmacies or the the healthcare providers can supply the vaccine and supply the people, but it's who do you partner with to build that trust, because you've got to have the trusted people there. And as I said to you, I think that's why it's been helpful when we've gone to schools or even into faith-based communities. We've certainly done vaccination in mosques and other things like that, because that gives people that confidence that they're part of a community of trust.
Yeah, and having those key community members involved in the information sharing and
making it as convenient for people to take the vaccine to the places where people would ordinarily go, whether it's Bunnings on a Sunday, whether it's the school, or whether it's the mosque. It's all of those things about it being part of their every day almost.
Absolutely. There is a question that has been submitted regarding the Queensland Government's concern about the opening up the borders and whether or not you are concerned that community transmissions will increase, particularly in Aboriginal and Torres Strait Islander communities.
Just if I can mention briefly, I think one of the issues with the vaccination rates and that we're looking at is, we've got that 70%, 80%, 90%, but of course that's the whole community, that's the whole of Queensland, and that will be influenced a little bit by what happens in southeast Queensland having higher rates. And so I think we're very aware of the fact that is that Queensland's not a homogeneous population, and we do have these pockets of much lower rates, whether they are particular groups of people or particular regions. I did hear Dr. Smith, who's one of the other deputy chos, talking about the fact that we've got sort of a few different levers, if you like, or a few different strategies that we can do when we're trying to battle this pandemic. One of them is contact tracing people, so finding cases early and isolating them, and that's a relatively fixed one. The other two things that are in balance with each other nearly are vaccination and then social measures, public health measures like lockdowns, like masks, like restricting people's movements. And the more vaccination you have, the less of the public health measures you need, because they're the only two things that we can really influence. So if you've got an area with lower vaccination rates and lots of vulnerable people, there is a chance that you will have to have those localised lockdowns and localised restrictions, although it will be on the basis, I think, of the vaccination rates rather than the fact that this is an Aboriginal community, or it's going to be more to do with that. And obviously we do want to protect those vulnerable communities.
Absolutely.
Do you want to add to that?
Oh, I just don't want to scare people. I just think, Delta is coming. And so the only way, the best way to protect yourself from it is to get vaccinated. That's the key message. And we need to do it, and when people need to act right now, they need to act now and get vaccinated.
Tom has made a really great point in the chat. Tom is from QCOSS, which is the Queensland Aboriginal and Torres Strait Islander Child Protection Peak, that organisations such as QCOSS will have an important voice here in understanding who some of the trusted voices are in these different communities that we're talking about. And on that note, Tom,
that'd be great if you want to reach out to Scott with some of those ideas.
Absolutely.
Is there a way that those on the line can contact your teams about ideas they might have for communities they're familiar with or working with? Is there an email or a phone number that would be best for them to contact?
Stacey, there absolutely is, and we can pop it into the chat, but it's essentially COVID-19 vaccination at health.qld.gov.au. So maybe, Stacey, if I shared that, if I share with you, Stacey, can you share that broadly?
Absolutely. We can send out a post-event email, which will have those details in it, and we do encourage all of you to please get in touch with the vaccination task force team about any ideas that you might have. Like it has been mentioned, there will be different strategies in different communities. We really need to do whatever it is that we can to give these communities the best chance they have at resisting the Delta, but also, as Tanya from Tully has said, not only Delta is coming, but other variants once the international borders open up. So yeah, best chance we have of protecting all of those around us and our health system.
Yeah.
Now, I know we're very, very close to logging off, and thank you so much for answering those questions. I know that there was a couple of questions we have around boosters, but I think we need to probably wait for the announcements regarding the boosters before we have some more information about that.
Yes.
The Targi will be putting up information. That's another place to go and have They've got some good public-facing information.
Yeah. There's one very quick question I'm going to ask. The vaccine hesitancy tracker shows a higher hesitancy at the moment in Queensland than in other states. Do you have any evidence that this hesitancy is higher for in some places than others for any particular reason? What? Well, that might be a
tricky one to end on. I mean, I think there has been, you know, there has been perhaps some complacency in Queensland because we've been so careful and we've been so fortunate, really, in many respects. What I think that the latest reuniting, you know, and the announcement about the opening the borders, I think that has helped to overcome some of that a little bit because people do see that it is going to be coming at that point, and you know, to not sort of be complacent about it, but I think it has sort of probably given a few people a bit of a wake up. And I think as well, we've certainly had evidence that as we've made vaccination more available, more convenient, more easy, for, you know, we've had a really good uptake, which probably tells us there's something a little bit about how we've had to change what we've done to make it easier for people to access it.
Well, thank you so much for your time. We're at time now, right on the dot. So thank you so much, both Scott and Lynne, for your time today and answering these questions. We encourage all of you on the line to get in touch with the team if you do have any other questions. We want to arm all of you with the best information you can get your hands on so that you can spread information that does address people's fears and does encourage them to protect themselves against COVID. Thank you for your attendance and your time. Have a wonderful afternoon, and we'll see you again soon.
Thanks everyone. Bye-bye.